I hope you are ready and fired up because at the ME Show, we bring the heat, we bring the education, and a little bit of entertainment. And today, I'm super excited, and I could not hide it. I am your host with the avocado toast, Ali Madawi, and you know that guy all the way over there, Kevin Gonzalez. He is the owner and operator of Activity First PT. He's here because he's got some great news, and we got a much better looking, a much smarter individual than all of us combined. And I say this with love and respect, who is the highlight of this interview that we are hosting today. She is amazing and put her literal hands on me. She fixed me many, many times that I came in and got hurt. So I know how great she is. She has an incredible personality, incredible attitude, an amazing work ethic, and one of the most educated human beings that you're going to have. But my guy, my friend, my partner in crime in here, well, not in crime, my partner in goodness and in positivity, Kevin Gonzalez, we have some breaking news that we are excited about for Activity First in Eatontown, New Jersey. Tell us a little bit more.
Thank you, Wally. Thanks for having us. Elise has been working with me for about 5 years now. She was a rehab technician, and she was doing really, really well. And then she decided to pick up the profession as a career. So she took a break from us to go to school, to finish school, because she was in school already. And then she went to Central Penn College and graduated with her degree in physical therapy assistant. She graduated physical therapy assistant degree from Central Penn College. She took her boards, passed her boards, and now she's ready to go. So now she's a licensed physical therapy assistant, which is great. So now she's able to work with patients, like Ali mentioned. And she's doing really, really great. Like I said, she's been with me for 5 years. The patients love her. And it's so great to expand my practice, because we are growing, to expand our practice and bring someone into the fold with the qualities, the skills, the personality that Elise possesses.
Well, we're excited because, I'm used to see that pretty face. I'm sure you've seen a lot of his videos. Hey, Kevin Gonzalez with Activity First. And I'm excited to hopefully get you to give us a few of those content pieces. But how are you? How are you feeling about being in a new role that you are in?
I'm excited. I'm looking forward to that pay raise.
She is funny because we talked about it offline. Yeah, see, that's smart. Let's go. That's what I'm talking about. Yeah. So do you see, obviously doing the profession for 5 years, you may say, well, nothing really changed because I'm used to it, right? But what has changed now that you got the education and the certifications to back it up as well?
Definitely the understanding of the why, of why are we doing these exercises for this. That why was really important. And I learned that a lot in school. And now I can back it up. Be like, oh, we're doing this because of this, because of this.
The biology behind it and understanding it.
Anatomy.
Yeah, see, I'm not even going to try to spell anatomy. Yes. This is why sometimes my brain's like, don't ask a follow-up. Just say, that makes total sense. Being in Activity First, you've seen many, many individuals, different ages. What would you say that you are most excited about as far as now that you are officially in a position and in a role that you are in? What excites you more about what is to come?
Definitely just working with patients more one-on-one, having that patient contact, and just seeing them go from day one pain, and then at the end of them being able to reach those goals that we came into coming to PT with.
How much has working with Kevin on a day-to-day impact on not only your growing as an individual and as a professional, and of course with your education? You feel like you had mentorship? Because some people treat positions just like it's just a job, but I'm doing my thing on the outside. Has there been any correlation to where you are right now with that relationship?
No, it was definitely
trying to get you that raise, if you know what I mean.
I appreciate that. No, definitely mentorship. And say, especially in the beginning, he kind of guided me, was like, oh, you should think about pursuing this. You're doing great with this. Patients like this. These are your options in the healthcare field. And just guided me from day one. And then I did my first 2-week clinical internship at Activity First again. Yeah. So I was back a little bit in between school, and just happy to be back again under his mentorship as well.
And I will, if I can just interject, in the business world, in the medical field, or anybody who's owned a business or managed a business, you have these unicorns of your profession. And I mean that because there's like only one person that can fill that role. And Elise is my unicorn. And I mean that all positive, because she has the whole package. She has the smarts. She has the work ethic. You name it, she has it. You know, when I saw what she offered to us as a rehab tech, and then she was considering it as a profession, I had to try to help to grow that. I forgot the proper term, but to help cultivate that. Thank you. To cultivate that. And then, you know, she made her own decision. Her sister's also in the medical field. She's an occupational therapist. So it was, I guess she could bounce some of these things off of her sister. And it just, you know, sort of got a life of its own. And next thing you know, she tells me, "Hey, Kevin, I think I'm going to look into physical therapy assistant school." So hopefully I'm not speaking, you know, out of turn, and I'm not saying anything incorrectly, but yeah, so she's great. And, you know, I'm glad she's decided to work with us after she graduated, and we're happy to have her. When she was away at school, there were patients that were coming in and saying, "Hey, where's Elise?" You know, they don't want to see me. They don't want to work with me. They want to work with Elise. So, and it's just great.
That's a good problem to have.
Yeah, exactly.
Yeah. So you're not also, you know, some stranger. You live in Monmouth County. You are part of the community itself. How important is it, whether it is for you or for the patient, to kind of be someone from within instead of just, because I know sometimes, you know, I got a referral of my dentist to a brand new office while I've been going to the same dentist for I don't know how many years, like a decade. And, you know, they're like, "Oh, you need to go to this dentist." I'm like, "Well, why don't I say it?" Like, "Well, you can come back to us, but for this specific process that you need, you got to go." And I cannot even tell you the discomfort in my brain. Like, even to set up the appointment, I was frustrated in the first, like, I'm not used to this. So how important is it to be part of a community for the successful relationship between the patient and the practitioner?
See those patients outside at Wegmans, and I run into so-and-so on the vegetable aisle. Or if we're talking about town events, like, "Oh, check out this." You know, just daily conversation that we have during the patients of like, "Oh, well, what are you up to this weekend?" And then I can be able to say like, "Oh, I'm going to give that a try. I'm going to go here. Like, might see you at the town event at the park this weekend," or anything like that.
You are a graduate of Middletown South.
I am.
Did you know since high school that this is what you were going to pursue? I know you had a little bit of a business path going on. What was the moment that you were like, "This is the profession that I want"?
I think it was a combination of Kevin supporting me and kind of telling me I was good at this and I should think about pursuing this. And definitely my sister, she's an occupational therapist, and she had been suggesting I go into this career for years. And then the final one was patients just affirming all of what they have been saying like, "You should do this. We want to see you be here as a PTA."
Well, how awesome is it that, you know, you listen to your patients? Because we always, you know, want the patient to listen, right? And that's phenomenal. Activity First has a culture within it, right? Like, you are expecting a certain environment. I know, you know, I look forward to going in there and in the weirdest way possible. I've hurt myself so many times and I get excited. I'm like, I know it's going to be Friends, or it's going to be a Big Bang Theory, or some baseball if it's an afternoon session, you know, and you're expecting a certain vibe in there. How has it been for you to see, like, was it always like that? Did it cultivate over the years? Tell us a little bit about you and your vantage point of that culture.
I think it was always like that. For me in the beginning, I was the new tech, and so I was a little quieter, didn't break through my shell yet. So I was definitely on the shyer side. And then as the years went on, we kind of wore through that shell, and now it's just full-blown, like, family style PT.
Do you find yourself quoting every Friends or Big Bang Theory when you're not in the practice?
Oh, yeah.
Yeah, me too. I can't even tell you.
Yep.
If I could just interject a little bit there. When Elise started, she started right in the middle of COVID. So we were all wearing masks, and right
He didn't know what she looked like until a year later.
That's an absolute truth. Since she interviewed wearing a mask, because we're all wearing masks at the time, she interviewed wearing a mask. I think she was there for about 6 months, at my office for about 6 months before I finally saw what she looked like without a mask. That's a true story.
And that's for you too. You didn't know what he looked like.
Well, I would take off my mask occasionally, go in the back.
Were you like, whoa, whoa,
No,
when he took his
no,
method.
I have asthma, so I had to go and take off of it. But anyway, but yeah, I didn't know what she looked like, her whole face, until about 6 months later. But before that, during COVID, we kept it on news or sports. But if you remember, during COVID, news was depressing, and the sports, there weren't a lot of.
It was weird
sports.
if
Yeah.
there was any
So
sports.
there really wasn't much to put on TV. It was Elise that said, "Hey, let's put on Friends. Hey, let's put on Big Bang Theory." So our current channel programming is due to Elise's recommendation,
You're welcome.
5 years ago. So now we stuck to that. And patients would rather watch rather watch something more entertaining like Friends or Big Bang Theory or Seinfeld or I Love Lucy, you name it, we put it on, than watching news or sports.
Mm-hmm.
Yeah, I think you haven't put what's the Lopez?
George Lopez.
I haven't put that in a while.
Yeah, we've put that on. We haven't put that on in a while.
Yeah.
It's just when you're looking now through the
Because the programming switched too,
yes,
so
exactly.
it depends
So it's hard to
yeah,
find, but
yeah.
we'll put it on if patients come in and they recommend and they request it. We'll put it on if we find it.
Yeah, I remember when you used to play gangsta hip hop for me when I walked in. The most no, I'm kidding, not at all. Working together for you, you finally have somebody who can not only help, but God willing, scale even the practice that you got two now instead of just one.
Right.
That's playing it by. I can only handle so much. What would you want the patients to hear about having Elise by your side now, and what should the experience be like? Like, what is the next level of activity for PT?
The next level, obviously, it gives me more flexibility because Elise can do everything that I can do. The only thing she cannot do is she can't evaluate a patient or re-evaluate a patient. So, but Elise and I are working next to each other all the time. So she sees what I do with the patients. She's known a lot of these patients for 5 years. We've seen me being here for about 20 years in my current location, been practicing over 30, I've seen, patients, their grandparents, their children, you name it, and I've seen generations. And they're all very comfortable with Elise because they've seen her at some capacity. Now she's at a different capacity. And I have the utmost trust with Elise, the way she runs a practice. She's not going to be there and I'm going to be disappearing. That's not the way it's supposed to happen. But, I'm going to be there. She's going to be working. And then, she's going to treat the patients just like I can. And to be honest with you, some patients, maybe I push them in a way that maybe it's a little bit too rough for them and they want to work with Elise because maybe she has a little bit more finesse. But then there are some patients that she's more aggressive than I am. So that does happen. And so it does give us a little bit more flexibility. If some patients, sometimes they would request Elise to work with them. Sometimes they would request me to work with them. But bottom line is we're there all the time. It's not going to be I'm here and she's not, or she's there and I'm not. That's not the case. And she just has the compassion, the skill level, you name it. She's the whole package.
Yeah. I've gotten you many, many times when we talk on, or record and whatnot, you explain how therapy is not just when the worst case scenario happens. Like you need to consider it at an early pain point, right? And many of the youth, knowing myself, young and handsome, I never listened earlier, to, like I told you, my goes all the way up and down. This is as much as it does because I broke my hand and I used to take off the cast for 8 months. I would shower, clean, and put that thing right back. And I didn't go to therapy. I was like, I don't need that therapy thing. Let's go play basketball. From your perspective, and if you could, what is your message to the younger athletes, collegiate or high schoolers who are, I got this, I'm good, it's not a big deal, on considering not only therapy, but, the physical recovery concept that comes through sports therapy? Tell us a little bit about that and, get your butt over here and take care of it before it becomes worse.
Well, that's the first thing is you don't want to get it worse, especially for a lot of these high school athletes who want to maybe play that sport in college, maybe go pro. Like they all have dreams. Like if you have an injury or if something just aches you just differently after practice or after a game, you just took a turn sharply and maybe it's just a little sore. It's always better to take action, just work it just a little bit, just come in for physical therapy, get it looked at, and just be more proactive because you want to last. You want to be able to maybe play for 10 more years, or maybe eventually you want to be careful. You want to be smart. And that's kind of the goal. And I do think athletes, especially younger adults my age, we're a very active generation and we can get injured still. we're getting older. And so when we do get hurt, we need to come to physical therapy, and it's good to be treated by people who like know, oh yeah, I play pickleball too. Like I know exactly what you probably did. Like let's do this, and then get you back on the pickleball court.
Yeah. I love how when you talked about how young we are, I appreciated that a lot. Yeah, I appreciated that. Yeah. There are different elements, different tools, different equipments. What is your favorite go-to for the, I know different treatment for different injuries, but what is like, I'm excited to use this equipment or this machine or this process?
Well, I think my favorite machine just that we get to use is what we call the big machine. And just because that has like so many uses on it, we do bicep workout, we do tries, we do little rows, you can do leg stuff on it. So that's just my go-to. Like, oh yeah, you're going to go to the big machine. You're going to go to the big machine. That's where you're going. And then like my favorite just personally is just electrical stimulation, just to help with the pain, help with the muscle, especially if you're like coming out of surgery. I just think there's a lot of use with that. And I've used it on myself personally and I love it.
Yeah. Kevin? Do you have a favorite monster?
Well, I have a StemWave unit.
The StemWave is probably the new baby, right?
StemWave, I got that about a year ago, and it's great. And Elise just hasn't been trained on it, so that's why she can't use it yet. But I'm sure once she test drives the unit, she's going to love it. But she has to go through the training for that. But I like the electric stim. I like the big machine, which is the cable column. We can do everything. I mean, we have ultrasound laser, electric stim,
massage
gun, taping, KT taping, we do cupping, you name it, and we do. We're a full service practice, and Elise can do it all as well. And it's just, and if a patient needs more modality based treatments, they'll get modalities. If patient needs more hands on type of focus, we can do that. We try to find the good balance. To find out what makes that patient feel better and what gets them to their goals, as Elise was saying. And sometimes it's decreasing pain. Sometimes I want to throw a football another 50 yards. I want to hit a golf ball 50 yards, maybe throw a football another 10 yards. So we get all different varied type of requests there and goals there that we have to meet. And we're ready to meet any challenge that a patient throws at us.
What would you say the biggest misunderstanding or misconception that many people have about therapy that you want to debunk?
A lot of people think like physical therapy is like any other doctor's appointment. You go in and you're bored, you sit there, you do this, and then you go out and then you're done. And then you can't go to the gym or you can't do this. Meanwhile, like we try to make it as fun of an experience as you possibly can. I mean, we have friends in the background, can't get better than that. And, we try to spice it up. We give you different exercises. We have that one-on-one contact that I feel like a lot of people just think, oh, I'm never going to see the PT or PTA again. Versus here, you see us all the time. We're always checking
literally every visit.
Yeah.
Visit and a lot through it. It's not like we're going to have you do an exercise and walk around. I'll see you when you're done with your exercises. If you go to that kind of physical therapy practice, please find another physical therapy practice because that's not the way it should be done.
And if they want to find another physical therapy practice, what is the website they should go to?
Thank you very much. Activity First PT, and first is spelled out FIRST. ActivityFirstPT.com.
Yeah, and if you're wondering, look right here. We just spelled it for you. You like that? Yeah. Okay, so you've given 5 years to you and your development. What is the next 5 years looking like for you, Rockstar?
Definitely staying here next 5 years. Plan on building up the community, supporting it, see what else.
This is the part where I put pressure. Do I get you to do a couple of those videos that we do with Kevin? Thank you, Lord. Woo! I mean, I love you.